morning, dear colleagues. We start our work in the Ukraine Crisis Media Center, and the topic of the first press briefing is international drug procurement at threat. Our speakers are Olga, Bogomolets, Hopko, Vitalyi, Shabunin, Olga, Stefanyshyna, and also Tetyana Kulesha, head of NGO Orphan disease in Ukraine. Vitalyi is given the floor. Good afternoon, dear friends. Thank you very much for your attention. I will be brief. Firstly, and the main. So, the transfer of the functions, and this is the difference in prices, is 700 million. 790 million hryvnias. So this is 40% from 2 billion that were spent for procurement, and we were monitoring these things. So 790 million hryvnias. And the oncology program is 60% economy, and for the sum that was economized, we could buy 3 times more medicines for treating oncology. 200 million are at the accounts of international organizations, and they were saved. So 200 million. And it was not possible when these procurements were made by the officials of the Ministry of Health. So we would like to draw your attention that this money was not obtained by those who obtained them before. So we fight corruption, and for all of us, this reform was really difficult, more difficult than creation of new law enforcement bodies. And maybe my colleagues will go into more details about the problems, because some people want to ruin this reform. And I would like to draw your attention to the scheme, the first scheme. So legislative or by law, it is impossible to change the procedure of this procurement. They want to try to buy this medicine through Ukrainian procedures. So they won't make any exclusions for Ukraine. So they try to introduce this norm into this provision and ruin this process. Also, they wanted to draw this money from the national program and to provide it to the regional level in order to lift control over this money. And we are concerned as organization that some people try to intervene in the process of procurement from SBU, and they sent a letter to the Commission to narrow the list of items, and this Commission did what it shouldn't, and they were convinced to do these wrong things by sending them subpoenas. I just want to say only one thing. On all state bodies, even SBU, they act according to proceedings that are envisaged by law. And we ask Mr. Gritsak to make public the arguments why this list should be narrowed. We do not discuss whether they do it correctly. They just should make these arguments public, because this is professional discussion of doctors, not the discussion of counterintelligence officers. So So I believe that SBU has other tasks to deal with. So Mr. Gritsak should find out why SBU is involved in this procurement, why do they intervene, and maybe we want to know, maybe there is a threat to national security, so we want to see this threat. And I give the floor to Olga Bogomolets, who is going to tell us about the threat of providing this program to the regions. So I would like to start, and this is really good, that 790 million were saved from 2 billion, and this is really a victory. And it is really great that we were able to transfer 2 billion to international procurement, but 2 billion are still in the Ministry of Health, and according to the all old mechanisms and schemes, medicines were bought by the ministry, and the previous staff of the ministry did everything possible together with some deputies of the Supreme Council. They do everything possible in order to postpone international procurement till December. And there were hopes that all the funds will be returned back in order that the Ministry of Health distributed these funds. So all those people who blocked international procurement in the Ministry of Health, no one was brought to responsibility. And unfortunately, these people, these teams that are at the level of laws blocked to international procurement, there were 4 parallel laws, the task of which was to block the adoption of this law. The same people do everything possible in order to discredit those international procurements that were made, in order to in this year, the Ministry of Health, not 100% were transferred, but they want to convince people that these international procurements are ineffective, and they want to that this money remain in the Ministry of Health. So our task is, from one side, to demand from international organizations to complete their obligations. And I would like to say that the Committee on Health, they have concerns about the work of international organizations, but these concerns, they are not principal in comparison with what these organizations should do. And we have some to Crown Agency that delivers with delay the medicines for Children's Hospital, and that's why we want this organization to be out of this and to provide this opportunity to procure these medicines to other countries. So 4 billion that were in the ministry and 2 billion went to international organizations, and 2 billion are still in the ministry. So 44 billion went as subvention to the regions. From this money, we do not know amount of what is the amount that was spent for buying medicines and equipment and other overall expenses. And we carried out examination, and only it demonstrated that the difference between the price for insulin in different regions, the same insulin, the same package, the same producer, the price differs from 30 to 120%. So one oblast buys the same package for 400 and another for 820. So even those who buy for minimal price, they all earn from this. So the overall saving on insulins around Ukraine, if everyone buys at minimum price, is 1 million hryvnias only for insulin. So we wrote letters to General Prosecutor's Office and the State Financial Inspection and Investigation and National Investigation Bureau. And for me, it is painful, but we should think about this matters, what we should do next. All these institutions, they provided an answer that General Prosecutor's Office do not see that that this is not their responsibility. Also, Investigation Bureau also believes this is not their responsibility. So the scheme, 3 companies are in the tender. From them, one is chosen who provide the lowest price. And there are no questions to the tender procedure if no one wants to deal with it. And if they chose the lowest price, there is no concern. But if this price is 100% higher than in the nearest oblast, and it can be 2 or 3 times more than in Belarus or other countries, so no one pays attention to it according to current Ukrainian legislation. So the only leverage how to change the situation and to control the situation is not the work of law enforcers. They are not able now because they are the part of the system of corruption in state procurement. There are only observation and recording by the Cabinet of Ministers, the reference prices, and at the top level there should be adopted a minimum price for insulin or any other products, above which they cannot buy in any oblast, in any region. If this is done, we will get, I think, not hundreds, but even more. Not hundreds millions, but maybe billions of saving that can be used to increase the salaries of medical workers who are now just surviving. And it's difficult to say about household corruption that is created because of minimal salaries. We will discuss these issues at a separate meeting. So the figures about the difference compared with those that were made by international organizations and by the regions. Decentralization, and I support decentralization, but when money goes to the regions and corruption goes with the money, and when there is no leverage how to influence and there is no professionalism, moral qualities, this decentralized corruption creates for the state more risks than corruption of the system at top level through which we can influence at the level of the ministry. So the price, I will tell you the difference between those medicines that were procured by international organization and in the regions. Cyclocytin, the difference 2.5. So international organization bought 2.5 times lower. So capramycin, 1,000 milligrams, vaccine for hepatitis B, 4.7 times the price is lower if it is bought through international organizations. So procurement through international organizations is one of the main leverage of influence at corruption, and the part of which is law enforcement bodies. And as to procurement in the region, we may say that the Cabinet of Ministers should demand to attach all the systems to Prozoro system, and I thank all those organizations, international organizations, who fulfilled their obligations, and I address it with official request to Anna Gabko, who cooperates with international organizations, and Ivana Klimpash, and to international organizations. Please inform the Committee on Health of what blocks international procurement and what blocked it in the previous ministry, and why some organizations didn't fulfill their obligations timely this year. Because diplomacy and good relationship is great, but not in the moment when we fight corruption inside the system. Thank you. Thank you, Olga. Anna. Thank you, Olga, for your principal position and for that the committee plays this important role to prevent corruption, and we have results in this 2 years that we are able to buy medicines through international organization, and also there was the law on deregulation of pharmaceutical market that reduces the number of days for registration to 17 days. So we saw great opposition towards these processes, and you know that there is a note of the Ministry of Health that demands that the health institutions should provide information to the media about the storage of medicines, and we ask parents that they should monitor the situation at the level of hospitals in order that there were no manipulations. So going back to our topic, we may say that the transfer of buying of medicines to the international organizations, this is not only anti-corruption action, this is a great opportunity to work with international organizations, and I would like to address to all international organizations that they should work not through some intermediary, but directly UNICEF, UNO, all organizations that are able to provide transparency in this process, to provide competitiveness and quality, and in that way we can prevent this huge loss of money when they buy medicines at a higher price. So you know that this is the lives of people. So if people have some orphan diseases or some hepatitis sufferers, so these people cannot get these medicines because of corruption. So last year we saw a great sabotage in the Ministry of Health at the level of the first deputy of the minister and others. And it was a difficult process, so we believe that this year, till 20 of July, as the government proposed, the international organizations should sign the contract, and the patients, they shouldn't go in the streets with the protests in autumn, as we see it, because the medicines are not procured in time. So some people want to prevent buying this medicine through international organizations, so the government should be strong and oppose those corrupt officials in the ministry. And also the deputy minister of health was detained, and it shows that things are not good at the ministry. So there will be 100 days that the government is in office. And where is the minister of health, and where are his deputies? Because they should clear the stables, and all these corruptions, they should be brought to justice. Otherwise we will see the sabotage longer. And the head of the committee, he should introduce the laws in the parliament, and the ministry should work with the committee, and they should deal with the issues of laws, decentralization, and important laws, not just fighting with the officials of the Ministry of Health and the pharmaceutical companies. And we address the government through consultations with the civil society, doctors, committees, parents, patients, and there should be a minister with his own staff of the deputies. They should work properly, and the pace of reforms should be accelerated. Good afternoon, dear colleagues. So the sum of about 800 millions that were saved, it says for itself, and we understand that this money will help patients to live better, and we see that you may see it in the leaflets we provided. Figures are even higher compared with the price of 2014. There are 20 times difference, for example, at one medicine, for example. So we see how effective is this reform concerning lowering of the prices and broadening the competition. Of course, at the beginning of this reform, we dreamt that all the pharmaceutical companies will be trading internationally and will contact the organizations directly, but it's not so easy. And as Vitalyi said, this is the most difficult reform in the anti-corruption reform in the health sector. And together with international organizations a year ago and 1.5 years ago, we didn't think that laws are not enough, and to advocate them in the Supreme Council. 8 months of the last year, we did everything possible in order that the Ministry of Health adopted the bylaws and started to realize this reform. But from experience, I can say that the green light for this reform was not provided by the ministry. Olga Vladimirovna told us about the problems with supply, and you will see in the leaflets that a lot of medicines, they still are not in hospitals. And we believe that the system of work of the ministry is to blame. So international organizations saved huge funds for the government of Ukraine, and this money is not spent because the Ministry of Health cannot provide to buy additional medicines, and the international organizations for many months wait for the permit from the ministry, and we have the deficit, and we should buy these life-saving medicines. Even absent cases are in place. So for example, Health Ministry orders some tablets for nosology, and the international organization cannot buy 283 tablets. It can buy only the amount that is in the packages. So, but second example, for example, vaccines. We do not have many vaccines, and there is a problem with the registration. When we developed the ideology of this draft law, we understood that this organization, as UNICEF, buys only vaccines that are adopted and pre-qualified by the World Health Organization. That's why we cannot verify, we should not verify their quality. But the ministry, they decided to get documents from the pharmaceutical companies that this vaccine was pre-qualified by the World Health Organization. But the person can get into the site of and see that this medicine was pre-qualified by the World Health Organization. And why do they want this huge amount of document? Because this is in the bylaws. So what we did, we wrote an address. This is the third one, to the Minister of Health. What should be done in the system in order that it worked next year, in order to lift these obstacles that prevent international organizations from bringing medicines. We have problems with VAT because bylaws are not good, and we have problems with the distributors who think that they will win in tender. They brought medicines but not in the right way, and we analyzed all the situation with our lawyers, and we asked the acting Minister of Health to see all those changes, because there is draft provision for 2017 that these changes are not included. So, Mr. Shafransky, you will get it in same trouble, and these medicines will be brought in 2018. So we are in delay. If we don't want to have some trouble with vaccination, we should order the vaccines in December last year, because the cycle of production is 18 months on average. And we should run and to start this reform. We start our day with a countdown, and we will bring on the screen citation from the acting Minister of Health till 20th of July. All international organizations will get money at their accounts to start the procurement. So this will be a major progress, and if it happens, we will be just support the work of the ministry. But I would like to note that this should be done in a correct way, because we will get in the same trouble we had last year. So we have proposals. We will provide them to the ministry, to the Prime Minister, to Vice Premier Rozenka, and the acting Minister of Health also. And lastly, I would like to say that the Ministry of Health of Ukraine, that is now without any control. We do not have minister, we have only acting minister, and one of the deputy of ministers, he left the ministry, by his own wish, and the second deputy was fired, and third was arrested. Do we have hope that international organizations will procure this year medicines and vaccines without troubles? So it's a concern. And we ask Prime Minister to do something with the ministry to say that there should be reforms, but because there are no reforms there is a team that does everything in order to prevent this procurement, and we feel it every day when we monitor the bringing of the medicines to the region. So we have 9 days, starting from today. We will follow the situation together with the deputies, and we will hope that we won't be in protests this year. So we have patients here in this hall, so we see the situation, and we want these medicines to bring more quickly, and we have constructive proposals to the ministry. So the next speaker, Tetyana. Good afternoon. I'm head of the NGO Orphan Disease in Ukraine. This year, our organization took part also in international procurement and to understand the situation. Sometimes they say that all the orphan disease are at international procurement, but were 20 million of hryvnias for nosology and from 10, and our patients were saved because through international organizations they bought medicines for this 20 million of hryvnias, and they saved 6.5 million of hryvnias. And for this 6 million of hryvnias, we were able to get to take 5 patients for treatment. And our organization, our patients were one of the examples, good examples, of how these procurement were done in 2015. But we should note that all our medicines that were brought to the patients, they were brought quickly. In March, our patients had all these medicines, but these are only for nosology. All other nosologies were bought from the Ministry of Health, through the firms, and as of today, I have many complaints that all the medicines from orphan patients, all who were through internal procurement, so these medicines are over. So our patients do not have these medicines. Gaucher sufferers and also other patients, they do not have access to this orphan medicines, and we have a huge problem in buying these medicines. And if need be, we will be going in a strike. So we demand that all the medicines are bought through international organizations. We see saving of the lives of the patients, and it gives us the opportunity to move forward. And yes, we say we will buy cheaper medicines, because for orphan patients it is very expensive to buy them. About the transfer to the regions, sometimes they say that nosology and phytonuria will go to the regions. We travel through 16 regions of Ukraine, and we know that in one region the package costs 20 hryvnias, and at the other region 120 hryvnias. So if this money goes to the region, our patients will be without feeding and without medicines. So if it need be, we will go in the streets, and we will fight for the cost of buying these medicines for our patients through international organizations. There is progress. Yes, of course, the situation is difficult. There are bad consequences, but there is still a progress. The documents And the provision of the Cabinet of Ministers is provided to the Ministry of Social Policy and the Ministry of Justice, and I address all the officials who can accelerate this process, that till 20th of July we would sign regulatory documents, and please help us and support this progress. Thank you very much for your attention, and we hope that this reform will continue and our patients will be having their medicines. So we have several minutes for questions. Please ask. Please be brief. Good afternoon, Igor Shidrin, Medical Control Organization. So 2 questions at once. Firstly, tell us please why some medicines on AIDS and HIV are bought 87% at higher prices than in the Ministry of Health 2014. I mean AIDS medicines, and you write that this program cost more than previous year, but the center in 2014 said that the Ministry of Health stole 26 million by exceeding the prices for AIDS and HIV medicines. So what is wrong? What was wrong there, and what is wrong today? And the second question about the economy. Only 42% of medicines are in the storage facilities. Then they say that some medicines, the cheapest, won't be brought at all, and the delivery will be cancelled at the end. Thank you, Igor. This is a very important question. It is important to dismantle myths about this economy, about this problem. So this issue is raised through publications and calculations. We consulted with all Ukrainian network of people who live with AIDS, HIV. They buy the same medicines, and maybe Sergei will add, I will be brief in my response, that we analyzed the procurement of 2014 and 2015 on HIV AIDS, and in 2014, and you may know about it, there was a year of humanitarian help for Ukraine, and some pharmaceutical companies that produce the medicine you've mentioned in 2014. It was a year when the war started, and we as patient organization pressured pharmaceutical companies that they would bring prices of 2013. So that was damping from some pharmaceutical companies, and it led to the fact that Alluvia medicine takes 40% of the procurement, and in 2014 its price was very low. If you compare with the real price for Ukraine in 2013, there is great saving, about 3 million hryvnias. Moreover, what we did, we compared the price of UNICEF in 2015 and Global Fund, and you know that we have the procurement of Global Fund in 2015, and the price is identical. So for the first time in Ukraine, we have the situation when the price through practically identical. So this example shows. So thank you for having opportunity to speak about it. And second question was about comparison. We calculated on the we took the information from the concluded contracts. We know that some Ukrainian distributors want to fail this course, and some intermediary pharmaceuticals didn't complete their obligations. And please provide information to your company that if they do not fulfill their obligations, we will inform every producer at the global level, and any global company won't deal with them because of it. So this is one of the scheme that was used by Ukrainian pharmaceutical mafia that wanted to kill international procurement. So this is the main problem why there is delay. So all the beneficiaries of the companies, we know that we will pay attention to each beneficiary who threaten the life of Ukrainian patients by failing to fulfill their obligations. And we will create a special list of names of these people who are responsible. So all Ukrainian network AIDS of people with AIDS. So we compared generics, and the comparison with 2013, 2014, there is a difference, and there is an extraordinary prices that are provided in 2014, and such medicine, Zelimavadin, we saw the fall from 40 cents to 19 cents for a pill. In other medicines, also 90% of decrease at the level of international procurement. If we are speaking about patent medicines, and they said that in 2014 they provided one-time prices because there was war in the country and a crisis and devaluation of the national currency, and the budget didn't increase some for these medicines that time, so the prices went up to several medicines. But at our calculations, there is a saving for about $1.5 million, and we can compare it with the year before without taking into account the ad hoc situation. That was about 2.8 million in savings. So this is assessment prices, and I do not know where do you find this prices, because this is not real. And in 2014, all multi-source companies provided decrease in prices, and only one medicine there was increase in Zelimavadin that was provided by the company Vitalyi Shabunin mentioned, who got 54 million hryvnias, about $3 million, and these medicines are not they are not delivered. So I mean that the farmer that was renamed and Fiolis Trade. So thank you very much. Until the next time, goodbye. Dear colleagues, our next event in 1 minute. Dear colleagues, journalists, if you want to speak further, you may do it off records.